Thank you for the invitation of being part of this meeting of the Jornada Internacional de Cadera 2024. My name is Francesco Benazzo. I work in Brescia in this hospital, Fondazione Poliambulanza. This is my university, the IUSS University in Pavia. And I've been asked by Francesco to give a talk on artificial intelligence. The use of the artificial intelligence is coming more and more popular, and also in the robotic surgery for surgical treatment of hip diseases and knee diseases is increasing. And the problem is that on one hand, artificial intelligence can provide big solutions to our practice, avoiding what is called physician burnout, medical mistakes. Still, we are just in the beginning of the utilization of artificial intelligence. So we do have challenges regarding the ethical deployment, the regulation, the clinical superiority of artificial intelligence over our own personal experience. We can talk hours about that. So I will try to give an overview on the artificial intelligence applied to the hip surgery. And still the question is open, is it a solution or he will give us a headache? Let's start from this. The artificial intelligence can assess the pelvic situation, and the evaluation of simple, normal 2D X-rays with artificial intelligence can really give us a very strong, deep evaluation and with high level of accuracy. Of course, the machine learning, the way we are teaching the neural network must be improved when we are jumping to severe disease like hip dysplasia or severe osteoarthritis. But programs available to grade the osteoarthritis of the hip, able to grade the osteoarthritis of the hip are already available. And the education of the program is absolutely important. So we do need the experience of a high-level radiologist to teach the program to read the X-rays and providing us with a deep description of the situation. And the way the machine, the artificial intelligence, can describe it, it can help us in assess the degree and also the evolution and the of the osteoarthritis of the hip. And these programs are able to predict the incidence of osteoarthritis, and they predict the incidence of a future osteoarthritis of the hip in all patients over 10 years. So providing the program of this artificial intelligence program with X-rays of the patient, the program can give us information on the possible evolution in terms of osteoarthritic degeneration of the joint. Also, other program can give us information of the condition of the muscles around the hip in terms of atrophy and fatty degeneration. So according to this program and providing him with a CT scan of the pelvic and the hip joint, we can have information with of the degeneration of the muscles in terms of atrophic condition and fatty degeneration, and correlate with the health-related quality of life scoring system. And so we can know which muscles should be addressed during the rehabilitation for hip osteoarthritis or preparation for a total hip arthroplasty, giving us a possibility to treat patients in a better condition when it is a moment for surgery. Planning also can be a very important role for artificial intelligence. And this recent study aimed to develop a comprehensive artificial intelligence preoperative planning system for a total hip arthroplasty and validate its accuracy in clinical performance. And this is extremely important because if you think of a huge amount of money invested by the companies for the inventory in our surgical theater, if we can avoid this and precisely define the type of the prosthesis we need for that specific patient and the size of the prosthesis needed for that specific patient, we can have exactly that size and that type of prosthesis in our OR, incredibly reducing the cost. And this program, I don't know if it is available, but it's been tested and it has been demonstrated the utility of that. And planning, of course, is important because it can assist us, especially the beginners, to not to waste time for planning, but to be absolutely accurate in planning, and is very much true compared to the traditional planning method. Also, the artificial intelligence in total hip and total knee arthroplasty has the potential to optimize the patient selection and also to predict accurately the post-operative outcomes, any possible complication, and the associated cost. So it's a predicting post-operative complication, pain, and patient-reported outcomes can be really well predicted by this artificial intelligence. And also the use of artificial intelligence technique, specifically machine learning, provides a potential unexplored solution to correctly and rapidly select suitable patient for arthroplasty surgery. So the decision-making when to operate, who operate for total hip replacement can be done with the help of this program. And this could bring to a revolution in the patient care pathway in the hip as well in the knee arthroplasty. And this is a project where we have probably the expected results published during the next month to improve the proportion of referred patients that are selected to undergo surgery. Not to talk about the use of artificial intelligence in the robots, and this is an example. You see Maku and Rosa, but we are at the beginning of the employment of the use of artificial intelligence in the robot. I will explain later on why. For the moment, the robotic-assisted technology may help us in reproduce very well the preoperative planning in vivo and achieve the operative targets during primary and revision total hip arthroplasty. Artificial intelligence can also be used in the extended reality. Extended reality means the possibility of increasing our skill in understanding what we are doing from the surgical perspective, and can be divided in augmented reality, virtual reality, mixed reality technology. And this is a new frontier for expanding our horizon to maximize education, expertise, and also execution. And you can imagine now, using robots, we are going from a 3D bloody field to a 2D clean screen. And this can be avoided by the extended reality with imaging in our glasses wear during the surgery. Another application for artificial intelligence in the hip is a periprosthetic joint infection prediction. And this is a MRI features we have been using in this program to train, validate, and to test a machine learning algorithm based on a SVM support vector machine to predict total hip arthroplasty. And the machine learning performance has been evaluated on independent data from the external testing cohort. And this program has been able to reach 92% of sensitivity, 62% of specificity, 91% of AOC in predicted total hip arthroplasty infection based on the edema of the bone, edema out of the capsule, and synovitis, best predictors for infection. So this model can support the radiologist in identifying and diagnosing total hip arthroplasty infection. Another application is the risk of deep vein thrombosis. So the machine learning models can help predict the risk of deep vein thrombosis after knee and hip arthroplasty. And this is absolutely important because if we know that the patient is at risk to develop that, we can prevent. Prediction of impingement and dislocation, another possibility given by the artificial intelligence. And in order to place and to implant and the reciprocal behavior of the cap and the stem to avoid dislocation and to reduce the risk of dislocation. Outcomes, and artificial intelligence can tell us, looking at the gait analysis of the patient, how good is our results, and the program can be trained, providing them with hundreds or thousands gait analysis of the patient, or to identify the arthroplasty implant. Just looking at this, right? Sometimes we are struggling to know which implant is carried by the patient, is being implanted in the patient, especially if we have to revise it. And this program can use an automated image processing using deep learning to identify, in order to improve, to identify the implant in order to improve our possibility of care. And of course, we need the cooperation of the manufacturers of the companies, but this program and in this paper, they show the ability of the program to identify 18 hip arthroplasty models from 4. And the neural networks offer a useful adjunct to the surgeon in preoperative identification of the prior implant. Again, post-op evaluation of the patient with a connection with the pre-op data and intra-op data. This is my bias because I work with Rosa and I work a lot with My Mobility, also improving the software included in My Mobility. But in My Mobility, there is an artificial intelligence telling us if the patient is reaching the good quality of a gait after 3 months compared to a cohort of patients included in the memory of this program, thanks to the artificial intelligence. So and this is a paper we have just published, is a patient care platform, has the potential to improve the experience by increasing the patient engagement, facilitating the monitoring, and providing personalized care. So this is an overview of the artificial intelligence. So the question is, where are we going? And I think that we should not think only positive, but we should consider that there are some risk in the excessive use of artificial intelligence. And overcome the human skill in the human fight. So I think that this process poses challenges and we must thank you for your attention.
Thank you a lot for your excellent presentation, Professor Benazzo. You have impressed me with your presentation about the AI, really. ¿Alguna pregunta en la sala?
Dr. Benazzo, one question, please.
Yes.
I'm very concerned about AI. Just at the end of your presentation, makes me a high degree of what we are going as a doctors in the future, because like companies with cars, the AI and the robotic is placing a big important decisions. Do you think that radiologists will disappear? Do you think that orthopedic surgeons, maybe in 20, 50 years, will be only people just to speak with him, with her, and telling what a robotic or an artificial intelligence will do with him or her?
This is a problem. This is really the issue I've touched with my final slides, and the videos and the sound I took in Dubai, the World Congress, some years ago before COVID, because it was very interesting, the use of these robotic devices, and they bring really this problem. I also, with a practical example, I'm working very much with robotic surgery, and I'm working to improve the skills of the robots and the content of artificial intelligence. So if you imagine a world or a robot where the robots, they can have a huge amount of information concerning gait analysis, preoperative gait analysis, the condition of the muscles, as I've shown, gender, the needs of the patient. At the end, we can arrive to the point where the robot must tell us or will tell us this knee, this hip should be done in this way. And we have at that point two choices: either to say, okay, I will do as you order to me. And if the patient is not satisfied, we can blame who? The robot, ourselves, the engineer, or we can decide, I don't want to do as a robot has told me, because I am the robot and I do in another way. And the patient is not satisfied, and he could blame the doctor because we didn't follow the suggestion of the artificial intelligence included in the robotic system. So it's like driving an electric car nowadays. If you are in an automatic driving system and you have an accident, who are we blaming? The driver or the engineer or the artificial intelligence? So the ethical issues with the artificial intelligence must be kept in mind, and we must take it into consideration. Otherwise, the risk is that the radiologists will disappear, the orthopedic surgeon or the surgeons in general will disappear, because everything will be done by robots. So this is a nightmare future. It's far away, but it's not so much far away from us.
Thank you.
Thank you.
¿Alguna otra pregunta? Really, I am a little afraid. I don't know if you have watched the picture iRobot. Yes.
Yeah.
What will happen to us in the future? The same that the picture?
Well,
afraid, really.
If we follow the three rules of Isaac Asimov, that should not be a danger. But again, the substitution of the man by a machine who has the weakness of our biology, and they can repair itself. That's a risk. And this is something related with some science fiction movies for the moment, but it's not far away.
Thank you a lot, Professor Benazzo.
Thank you.
Thank you. See you again.
See you. Bye-bye.